any man over the age of 50 can develop prostate cancer. I'm talking about one of the most prevalent cancers that affect the male. I'm talking about the prostate now. It's not just the cancer that affects the men. There we have something called BPH, benign prostatic hyperplasia, where the prostate gland increases in size, like enlarges in size. And that's not cancerous, but it's also a problem because it causes a lot of issues for the men. So what's the prostate? A lot of people don't know what the prostate is. Women do not have the prostate. The prostate is a gland that is located beneath your bladder and in front of the rectum. So what the prostate does is it secretes fluid that make up the semen. Yes. So the semen is not complete without the prostate, like the fluid that is secreted from the prostate gland. So the fluid that is secreted from the prostate gland makes up part of the semen, semen. Yes, the sperm. Prostate cancer is a kind of cancer that affects the prostate gland, and normal size of a prostate gland is the size of a walnut. This is how the prostate is supposed to be. But what happens is as you advance in age, the prostate begins to increase. You get to 40, it begins to increase. At 60 years of age, it's supposed to be like the size of a lemon. A lot of men, it is common for the prostate to enlarge in size. It's common. But when the prostate enlarges, you need to be sure if it is just, an enlargement or if it is cancer. So these are signs that will help you detect if, you have prostate cancer. And before I list the signs, I want you to understand that there are factors that can expose you. There are risk factors. Number one is age. So once you get to age 50 or 60, from age 50, 60, already you know that your prostate is already enlarging in size. So you are at risk of developing prostate cancer. Number two is ethnicity. So when I'm talking about ethnicity, it means that prostate cancer is more likely to happen to, black men or black Africans than the whites. That's age, ethnicity, genetic factor, like, from the gene, then family history. If you've had history, like there's someone in the family that had prostate cancer, someone that is a male in that family is most likely to come down with prostate cancer. So here are signs that will point to you and tell you that, brother, your prostate ain't working anymore. One is painful ejaculation. When you are doing mekwe, when you want to release, when you want to release, you discover that your ejaculation is very painful. It's not supposed to be so. Number two is you notice when you pee there is blood in your urine. It's a sign, that your prostate is calling for help. Your prostate is in danger. Another sign is blood in your semen. Like when you release, apart from feeling the pain, you notice that your semen contains blood. It's a sign that your prostate is there is something wrong with your prostate. And urgency in urinating, you always have the urge to urinate. Every time you have the urge to urinate. Another sign is poor urine stream. So urine stream, that thing that when you urinate, your urine, the flow can get from here like to some distance away from you. But if you notice that when you urinate, your urine cannot pass a few distance, like it's almost soaking your body. Then we have erectile dysfunction. You can no longer, you're not sexually, you're not there again in that, you're not functioning again. So that's also a sign of prostate cancer. So if you notice any of these signs, the good thing about prostate cancer is that early detection, you can be saved. The prostate tube can be removed. The procedure is called a prostatectomy. It can be removed, take away the prostate, and you can do just fine without the prostate. So It's nothing to be worried about, but the issue comes when you don't pay attention to all the signs that I mentioned earlier. And when you now notice it, when you get to the hospital, it becomes so bad that it's now a 50-50 chance. Maybe the cancer has already spread so bad that you just have to be on hospice care, or you just have to manage do chemo. So to avoid that, because you can do just fine without the prostate. So that is it. Don't forget to like, share, comment, and subscribe to this YouTube channel.